This is an indwelling urinary catheter, sometimes called a Foley catheter. The Foley catheter is a thin, flexible tube that is inserted into the urethra up to the bladder to drain urine. The urine is drained into a urinary collection bag. The catheter is held in place by inflating this balloon with sterile water. These are the supplies that you may receive: a weekly large urinary bag, a weekly stat lock or leg band, depending on your preference. These are additional items you may receive upon request: a weekly leg bag, a weekly extension tubing for your leg bag, and alcohol wipes. This is a urinary bag. The urinary bag may look slightly different but have a similar concept, and one end of the bag has the drainage tube connected to the catheter, a clip to secure tubing to a fitted sheet to prevent it from moving while laying down, and a hook for hanging the bag upright onto a bed or chair. The bottom end of the urinary bag has an outlet device that consists of a drain spout, a clamp, and a protected plastic cover to prevent contamination. The other type of bag that you may be given is a smaller leg bag. This bag may also come with an extension tube. There are two ends to the leg bag. The up end has a blue cap that can be removed to attach the extension tube, if used. If you do not have an extension tube, this end will be directly attached to the Foley catheter. On the other end of the leg bag, there is a drain spout that can be twisted to drain the urine into the toilet or container. There are adjustable elastic bands on both ends to secure the bag to your leg. The leg bag needs to be below the bladder, either on the thigh or below the knee if an extension tube is used. Fasten the bands just enough to hold the leg bag in place. This will allow urine to flow downward and prevent it from going back into the bladder, which can lead to an infection. Those who are more active and mobile can use the leg bag to be more discreet when outside the home, but you will have to empty the leg bag more often because it is smaller. Always replace the leg bag with a larger urinary bag before sleeping, napping, or reclining in a chair. You will need to change your old bag to a new bag each week, and new bags will be provided. You will also receive either a leg band or stat lock, which are securement devices to help keep the Foley catheter in place. To attach the leg band, wrap it around your thigh using the Velcro, placing the green straps closer to the top of the thigh. Then, place the Foley catheter between the two green straps, allowing enough tubing from the penis to the securement device to prevent pulling. Fasten the green straps around the drainage port to stabilize the Foley catheter. To place the stat lock, first wipe the skin with the skin prep wipe included in the kit. Then insert the catheter into the stat lock. Remove the backing to expose the adhesive side and place the stat lock close to the top of the thigh, allowing some slack to the catheter. You should empty both the large urinary bag and the smaller leg bag when they are 1/2 to 2/3 full. Don't let them fill completely. Before emptying or touching any part of your catheter bag, make sure you wash your hands with soap and water for 20 seconds. If someone is helping you, they must also wash their hands. Empty the urine by first placing the bag over the toilet or container. Remove the drainage spout from its protective cover. Aim it at the toilet or container, unclamp the spout, and drain. Once the bag is empty, wipe the excess urine from the spout with toilet paper. Close the clamp, wipe the spout again with an alcohol wipe, and place it back into its protective cover. Empty the urine by first placing the bag over the toilet or container. Twist the blue drainage spout to drain the urine. Once the bag is empty, Wipe the excess urine from the spout with toilet paper. Twist the spout closed, then wipe with an alcohol wipe. To change your urinary bag to a leg bag, begin by washing your hands with soap and water for 20 seconds. Set up your leg bag, and if you have an extension tube, connect it to the leg bag and set it aside on a clean surface. Empty the large drainage bag into the toilet. Remember to never let anything touch the drainage spout. If something does touch the spout, wipe it with an alcohol wipe. Wash your hands again with soap and water for 20 seconds. Place a towel under the connection between the catheter and the tubing, then pinch the catheter to prevent leakage. Twist to disconnect the drainage tube from the catheter and attach the leg bag. Connect the leg bag to the catheter tubing by twisting and pushing the two tubes together. Fasten the top and bottom leg strap below the bladder, not too tight, leaving some slack to prevent pulling of the catheter. If you're more active and prefer to have the leg bag below the knee, use an extension tube. The extension tube can be cut to adjust the length. One end of the extension tube attaches to the Foley catheter and the other end to the leg bag. Use the straps on the leg bag to secure it below the knee. Wash your hands again with soap and water for at least 20 seconds. Wash the urinary bag when you are switching between the large urinary bag and the leg bags. If you're not switching between bags, then make sure to replace the large bag with a new one every week. To clean your large urinary bag before switching to a new leg bag, mix a 1-to-1 solution of vinegar and water. Then pour the solution into the urinary tubing and bag using a clean funnel. Swish the solution around for 30 seconds and then drain it out. Then rinse out the bag with warm water. Keeping the drain spout open, hang the bag so the spout will not touch anything and allow it to air dry. When reusing the larger bag, remember to wipe the end of the drainage tube with an alcohol wipe before reattaching it to the Foley catheter. Wash your hands with soap and water for 20 seconds.